Thank you, Mr. President. Mr. President, I come to the floor having heard my colleagues' concerns and story of a family that was helped by the President's health care law. And we want people in this country to be helped. My concern is there are a lot of people that are actually being hurt by the President's health care law, and we shouldn't have to hurt people, specifically people that have had insurance, to try to help people that haven't had insurance. And that is the big concern that my friend from Connecticut referred to as I came to the floor this morning to discuss. I have great concerns about the impact of the people of Wyoming and of all around the country as we are getting letters and concerns. And we were told on the floor that all of these stories, 9 of us were up here reading different letters, that all these stories are lies. They're not lies. These are people hurt by the President's health care law, and we see them in states all around the country. We don't know how many people have signed up, how many have gone to the website. The White House can't even tell us if they know how many have insurance. Sure, they may have had a lot of people visit the website. We don't know how many people have actually paid to have insurance. So what the President asked for was he said we're going to get 30 million people who didn't have insurance to have insurance. It looks like there may be fewer than 2 million people that go through that. We know that fewer than 1 in 10 young people, the people that are supposed to pay for this program, young people paying more so that older, sicker people will pay less, those people aren't signing up. Only 1 in 10 of those eligible at that age are signing up. I mean, that's what we're seeing across the country, and that's why their worry is that there's going to need to be a big bailout of this program because the money being spent by the taxpayers on this is not getting the job done. And they're not doing it in a way to actually help the people that need help without hurting so many other people, the 5 million people that got letters of cancellation. So I hear from my friend and colleague from Connecticut, I say, you know, it's not just people, that one person that may have gotten insurance in Connecticut who may have been helped in that situation. The impact on jobs in communities has been dramatic. I mean, when I look at that state of Connecticut, there's a story in the New York Times just last month about the impact of this law that my colleague and friend has voted for, that has now been changed over 24 times, where they're interviewing a superintendent of schools in Meriden, Connecticut. We've just heard a story of somebody that was helped by the health care law. Now let's take a look at what's happened in the superintendent of schools in Meriden, Connecticut, Mark Benigni. He's also a board member of the American Association of School Administrators. He said in an interview, this is New York Times, said in an interview that the new health care law was having unintended consequences for school systems across the nation. So we have a letter from somebody in Connecticut. But let's see what happened to school systems across the country. Maybe they have children in school. I don't know. In Connecticut, it says, as in many states, significant numbers of part-time school employees work more than 30 hours a week and do not receive health benefits. Well, you know, the health care law, Mr. President, defines a work week as anything above 30 hours. So they have people that are working part-time, but more than 30 hours. So according to the health care law, those are full-time employees. So they have working more than 30, do not receive health benefits. And as he says, are we supposed to lay off full-time teachers so that we can provide insurance coverage to part-time employees? That's a question asked by the superintendent of schools in a town in central Connecticut. He asks, if we have to cut 5 reading teachers to pay for the benefits for substitute teachers, I'm not sure that would be best for our students. So the impact of this health care law and the mandate and the costs go way beyond the health care of an individual or a family or a community. It goes to so many other things, including the education of our young people. And that's the sort of trade-offs and the unintended consequences that have developed about a health care law when we pass a 2,700-page law. And whether they delay or not the sign-up date to allow more people to sign up, and as a doctor, my concern is for those people that sign up, what kind of care are they going to get? Are they going to be able to keep their doctor, which the President promised? The deadline date is less important than the kind of care people can get with the insurance that they are mandated to buy as a result of the health care law, and pay a lot more than they would have paid had the law not been passed. So will they be able to keep their doctor? Will they be able to see a doctor We know there's a shortage coming of 90,000 physicians, half of them specialists, half of them primary care physicians around the country, coming in the next 5 or 6 years. We know the things that are happening along those lines with not enough nurses, not enough physician assistants, not enough EMTs, paramedics, across the board, not enough people to take care of the population of this country. Having insurance isn't enough to provide care, and the president made promises that are not being kept. And that's the concern I have when I hear that the deadline is extended. My concern is what happens after they sign up. Will they be able to get the care they need? The Associated Press last week reported that they polled all of these different cancer hospitals. My wife's a cancer survivor. I know how important it is for people to be able to have a peace of mind to get the care they need. Of the 19 hospitals that responded, only 4 of the 19 to the Associated Press have said, yeah, they will be able to accept all of the plans for the people who are signing up on the website in those states where those hospitals are located. So it's not just a matter of keeping your own doctor, it's getting the doctor you need at a time of family crisis, personal family concern, the times when people are most vulnerable. And yet, will the fact that they have some coverage bought through a website, will that actually help them get the care they need? And will the doctor who happens to see them, even if they're able to keep their own doctor, be able to spend the time interacting with the patient, or with all of the additional paperwork and time consumption activities, will the doctor have to cut the visit short, spend time looking more at the computer screen than looking at the patient? And there are complaints in every state of the union, Mr. President, I will tell you, from patients who are complaining either to their doctors or the nurse in the office or at the checkout area of the office to say, you know, I would have liked to have a doctor look more at me and not look so much at the computer screen. So there are so many components of this health care law that are harmful to health care delivery and to patient care in this country. So the president decides to unilaterally delay a part of the law that just last week or the week before the Secretary of Health and Human Services says will not be done. This is the deadline. This is it. When is the law not the law anymore? When is it just Swiss cheese? When is it the president? When do you trust somebody, take them at their word? What words have meanings? And it's time for this president and this administration to actually realize that the American people see what's happening. And each time they do a delay or do a change or do this or that, that has a huge impact on people's lives as they try to decide what to do and what matters and what doesn't matter under this administration. People are very, I think, disappointed. And as a result of the health care law, those who are looking for something better, they haven't found it. We still don't know how many people actually have paid for insurance. We may know how many went to the website. We don't know how many of those who bought insurance through the website actually had their own insurance, got one of those letters, the 5 million people that got letters of cancellation. How many of those were canceled and how many were uninsured? Looks like the website doesn't even want to look into that. On the paper application, there's actually a box to check off. It says, you know, I didn't have insurance, but now I'm going to get it. Website left that off. I don't know if that was an ineptitude on the part of the designers of the website, if it was left off, if it fell through the cracks in the disastrous rollout. I don't know, but it wasn't there. So the administration, which said our goal is 30 million people, cannot tell people that did not have insurance, getting them insured. The administration will never know the answer to that. And then the question, how many of these are really, who are these folks in terms of young or old, sick or not sick? And we know that of those eligible, only about 1 in 10 has signed up. And the big concern, regardless of some of these things that the president is doing to delay this and let others sign up or not sign up for a bit of a time, my concern is what kind of care are they going to get when, whether they're insured through the website this week, next week, the week after that, what kind of care is going to be available to them when they find the cost of the care for so many people that I hear from in Wyoming is much, much higher than they were paying before if they had a policy that they liked, or still finding if they didn't have insurance that for many of them they still think that the rates are unaffordable. So thank you, Mr. President. I yield the floor.